Gibson Kohli coming to you with Snackable Health. Big news this week about colon cancer screening. You may have seen this pile in the New England Journal. I'm sure you did. They randomized people to getting invited to get colon cancer screening versus not. And they really didn't see a difference in mortality at the end of 10 years, 0.98% versus 1.2%. And people have really kind of poo pooed this result, so to speak. But on the other hand, 42% of those people who got invited had the screening. So, a lot of people didn't even get the screening. It's hard to show a benefit of a screening tool if you don't get the screening. So that's one of the criticisms of the study. If you look at the people who actually did get screened, they did have a reduction in mortality and lower rates of colon cancer eventually. Now, that's caution needs to be exercised there because the people who participated and got screened may be very different than those who didn't participate. So we kind of shy away from these kinds of analyses. So these results are for population screening. They may not apply to an individual patient. I, for instance, have a family history of colon cancer, and I've elected, to continue to get screened. So my colon, my choice. What are your thoughts on all this, Pam?
I agree with your colon, your choice, Mike, but I also think that the study was flawed in its design. I don't think it should have been looking at people getting invited to get screened. I think it should have been looking at people getting screened versus those not getting screened.
So
I do commit.
you would have randomized people, to screening or not screening, essentially, who agreed to get screened.
That's exactly right, because that answers the fundamental question of whether screening works. To your point, what you just pointed out, if only 42% of people who got invited actually got screened, we're just asking the question or answering the question of, does an invitation to get screened reduce your risk of dying from colon cancer? And the answer is no. But if you actually get screened, I suspect it would reduce your risk because you're picking up early stage cancer. So I think the study design was flawed. Personally, I'm going to continue to tell my patients to continue their colon cancer screening, but I do commend the authors for asking an important question, which I think we should be asking for more types of cancers, even for heart disease, in fact, is the way we're screening people the correct way to look for disease? And is it actually impacting their outcomes? Or is it just exposing them to additional test procedures and potentially not impacting their outcomes? So I think with heart disease, this becomes a very interesting discussion because the way we screen people is we just look for risk factors, which I think is completely backwards. We ought to be looking for disease. We ought to be doing low dose CT angiograms on people to actually look at their coronary arteries and see if they have plaque or blockages, rather than guessing based on their risk factors whether or not they're in a high risk group or not.
I also want to point out these results were in contrast to what's been seen with another procedure called flexible sigmoidoscopy, where you don't look at the entire colon, you just look at the bottom half of it. And using that procedure, there was a reduction in mortality in meta-analyses on the order of about 30 lives saved per 10,000 screened. So the idea of looking is well founded. It would be hard to believe that just looking at the bottom half is better than looking at the entire colon. So I think I agree with you. The study was interesting. I would have done it a different way. I agree. I'm going to continue to get screened, recommend screening particularly for my high risk patients. I guess that's the take home message for our audience.
Yeah, and it's shocking to me to hear from the CDC that up to 1 in 5 eligible Americans eligible for screening have never gotten screened. So I think the message here really needs to be, let's continue to look early, look aggressively for cancer, and really catch those cancers early so that they can be cured, rather than just sort of sitting on our hands and waiting for it to declare itself.
I was one of those people who's really scared. I got to be honest. I was very fearful. I didn't want to do it. But, they gave me sedation. I didn't even know what was going on. I slept through the whole thing. So don't be scared. There's no pain. You get put to sleep and wake up. It's the first good sleep I'd had in a while. So I wouldn't be fearful of getting the procedure. The prep's a little tough, but it's getting better and better. Well, thanks, Pyle, and thanks to all of you for joining us here at Snackable Health.